Breast cancer is one of the leading causes of death among Filipino women. Some may not notice this, but this disease has been afflicting not only older women, but also younger ones or those under the so-called reproductive age. And as we commemorate Breast Cancer Awareness Month this October, we are joined this morning by medical oncology hospitalist, Dr. Toni Ong. Good morning, Dr. Toni, and welcome to Daybreak.
Good morning, Ms. Emeline, and thanks for having me here in Daybreak.
Now, it's Breast Cancer Month, so maybe you can share with us the latest data on breast cancer.
Well, the latest for today, it's still breast cancer that leads among the cancer diagnosis in women here in the Philippines and also globally. And we are seeing trends that we get to diagnose it already in the younger age group, like the 20 to 39 age group. And reasons for that is still unknown, but Philippines has still the highest incidence in the Southeast Asian, among the Southeast Asian countries when it comes to breast cancer.
Now, so you're saying that younger women, does that also mean that the annual checkups, instead of 40 and above, should it be earlier now then?
Actually, it's still on the 40 years of age, the annual mammography. But for those who are at a higher risk, like they have a strong family history of breast cancer in the family, they can have the annual mammography as early as the 40 years old.
I see.
But we advocate the self-breast exam for women as soon as they reach 20 years of age. We advocate that they do the self-breast exam every month.
And I also heard something about this new way of identifying breast cancer, because it's usually through, apart from the self-breast examination, there's the ultrasound and the mammogram, but there's this new equipment called MEIK or MEIK?
Yes, MEIK. It's still not available in the Philippines, but it's among the latest, and I think based on research, they do not use radiation. It's based on the electroconductivity profile of the cells, because it seems that the malignant cells in our body has a higher electroconductivity profile than the normal cells. So it detects it that way, and it also detects malignant cells, the breast cancer tissues, 3 to 5 millimeters. That's what they said.
Even the smaller ones, they could already identify. Well, that's good. It has no radiation. It can identify smaller tumors.
Yes.
And at the same time, it can even already somehow detect if it's malignant or otherwise. You don't need a biopsy.
But still, the biopsy has the last say. Although it can just locate the tumor, its size, and it's said to be portable too.
Okay, so not yet available in the Philippines, but okay, let's talk about the latest treatments or the latest management measures for those with breast cancer. Let's start with chemotherapy. Are there new drugs, or how is it different nowadays?
The drugs are really evolving month after month, because among the cancer, I think breast cancer is among the widely studied here and worldwide. So we have the evolution of the latest chemo and the latest trends every month. And treatment of cancer is we're not really treating the disease but the person, so the treatment has always to be individualized.
I see.
So it depends on the options, it depends on the age group, whether you're on the elderly age group or on the younger age group, on the reproductive years, or...
What's the difference between a younger age group and the elder age group when it comes to breast cancer chemotherapy?
We can offer, the aggressive protocols can be offered for the patients who are in the younger age group, because usually those belonging to the elderly age group, they already come with comorbidities or the other medical problems, so it's difficult to start aggressive treatment on this age group.
So in a way, it helps also for those who are younger, because you can introduce the stronger ones, I would say. Now, I heard about the targeted treatments. Now, how is this different from, let's say, 10 years ago? What are these targeted treatments for breast cancer?
So targeted treatment is technically not a chemotherapy. When we do the biopsy for the breast tissue, we also do the ER and the PR and the HER2 testing.
I see, to see what kind of breast cancer you have.
Yes, that's the breast panel exam. It's measuring the estrogen, progesterone receptor, and the HER2, or the human epidermal growth factor of the tissue. So if you're positive for the ER and PR, then you are a recipient of the certain drug called the hormonal therapy. And if you're a HER2 positive, this one is a more aggressive type of cancer, you will qualify for the targeted treatment.
So it's specifically for your particular breast cancer diagnosis.
Yes.
But I heard it's quite expensive, although recently it has lowered its cost. And how true is it? Like the patent, if I recall, has already been lifted, so there are others who are trying to develop the same targeted treatments as well at hopefully at a lower price.
We're
Tell us more about
expecting
this.
that the targeted treatment will be lowered in terms of pricing probably this year, since there are studies already coming this year and probably is already ongoing right now. So we're hoping too that it can be already
reachable.
Yes, because the
Easily,
targeted treatment, you're going to have it for a year. Like when you receive the chemotherapy for probably 4 months or 4 to 6 months, then you still get to have the targeted therapy for a year if you are a HER2 positive.
Now, Dr. Toni, many people are still afraid of the horror stories that they've heard about chemotherapy, but I understand there are new, what you call adjunct treatments to soften the impact, so to speak. So tell us more about that. Like, for example, the nausea, the vomiting, is these drugs to control that?
I know what you mean when you say the horror stories, because the movies these days are, I think, over-sensationalizing the effects of chemotherapy, which makes a lot of people scared of it, especially the most notorious one, the vomiting, the hair loss, and the nausea. Well, even if we have the latest trends in the chemotherapy, we are also having the latest trends when it comes to the anti-nausea and anti-vomiting treatments. It comes in many forms these days. We already have the patch. You don't have to take it orally. You just have to patch it on your upper arm, and it will cover your chemotherapy-induced vomiting for a week. Because
so no
we
more
also
vomiting.
have
in essence, if ever it does, it's lesser.
Yes, because we also have the delayed chemotherapy-induced vomiting. Sometimes it sparks up on the 3rd day or on the 5th day.
So that is also covered by these new
this
drugs.
patch.
By this patch.
Yes.
I see. Now, what about the nails? It's sometimes I've seen cancer patients who have darkened nails, and their skin are burnt because of radiation. Is there something for that as well?
Yes, we are already having the so-called nail hydrating solution that they can just apply on their nails, and the hydration creams for the area where radiation will hit, so that they can, well, not really, so that they can lessen the adverse effects of radiation, of the chemotherapy. It helps them regenerate the nails. And
what about the immune system, which they usually say, you can't go out if you're undergoing chemotherapy? What's for those who have immune problems?
Well, that's because chemotherapy can induce neutropenia. It means that your WBC is lowered,
white blood cells.
The white blood cells are lowered, the neutropenia or the neutrophils are lowered on the first week of your chemotherapy. So that's why we tell them to stay at home on these days or wear a mask when you go out, because the immune system is at its lowest on these days.
Is there a drug also for that? I mean, to at least, to add more white blood cells, and especially those who want to travel.
Yes, so it comes in an injectable form. We inject it subcutaneously. It's very quick to administer. We can even teach the family members to administer even if they're just home.
I see.
If they're just staying at home, they can administer it to the patients. And it comes also in 2 forms. One has a shorter half-life, and the other one has a longer half-life, but it also costs more.
But at least that protects you longer.
That protects you longer,
one.
especially if your job is you travel a lot. So we inject that to them, and it has a half-life of 15 to 80 hours.
Okay, so of course one of the things that we see when it comes to chemotherapy is that it's expensive. But I understand that there are groups who have fundraising activities, which is what you would like to tell us about for this month of Breast Cancer Awareness Month. Tell us more about this one.
The St. Luke's Medical Center Global City has its own cancer support group, the Corridor of Hope Global City, and for the whole month of October, we're celebrating Shop for a Cause this Pink October. And we're actually selling some Hope apparels. We call it Hope apparels, like the pink bracelets with a pink cancer ribbon, because the color of breast cancer is pink.
Yes.
And we also have pink earrings, and we also have a Hope necklace for men.
So these are made by cancer patients?
These are made by cancer patients. We
see.
have a designer, BJ Chavez, and he taught the patients how to make these apparels.
I see.
And during one of our support group meetings, we also advocate occupational therapy. Like we let them make accessories of their own.
see.
We let them make handcrafted.
So this is the
Christmas
result
cards,
of that.
and this is the result.
And the proceeds
of
of this fundraising activity will go to...
will benefit the Corridor of Hope so that we can keep the support group alive. We're meeting every month, and we are addressing the emotional needs
I
of
see.
patients and their family members also.
Okay, thank you so much, Dr. Toni, for joining us this morning here
Thank
on
you for
Daybreak.
having me here.
So we just spoken with Dr. Toni Ong. She's a medical oncology hospitalist of the St. Luke's Medical Center, Global City.